I want to mention that I know many Albertans are thinking about hockey right now and wondering how the NHL's hub event might be held in Edmonton without jeopardizing public safety. I do not have any news on whether Edmonton has been officially chosen by the NHL, but if it is, I want to assure everyone that safety remains our top priority. This spring, we developed guidelines for professional sporting tournaments to support safety for players, NHL staff, and media, and to minimize any risk of virus spreading to the general public. While there are many components, the approach relies on extensive, privately purchased testing, and the NHL players and anyone else involved in the tournament forming a cohort that is separate from the public. Cohorting among the participants will reduce the risks of disease spread if a case is identified. If Edmonton is chosen for the NHL's event, health officials will work with all applicable partners to ensure the guidance is followed to protect the public and those involved in the tournament. We will also ensure that public testing is in no way impacted if the NHL does pick Edmonton. With respect to the NHL, I was part of a conversation I believe it was last week, discussing different aspects of potential return to play protocols. So it's not, I don't feel like I've been left out of the loop. I believe I've had an opportunity to provide input. And several months ago, we did put together return to play safe guidelines from a proactive perspective here in Alberta with respect to the kinds of things that would be needed in order to protect players, protect the other people around the team, and protect the public. The protocol that we've put together focuses on the critical bubble being those who have face-to-face contact with each other. That is the dominant mode of spread of COVID-19, is through that face-to-face contact. With respect to others who may be, for example, cleaning that space, we do know, of course, that transmission from surfaces is a possibility. But the difference in risk means that those particular individuals, again, there will be certain protocols for them to follow. But if there's no face-to-face contact, there wouldn't be a requirement that those individuals remain in the bubble. Again, some of those specific details about the requirements and the testing for those individuals are still being worked out. But the ones who need to remain in the bubble are those with that close face-to-face contact with the players who are going to be, again, in tournament play. In our assessment of what criteria we would require for a safe tournament with respect to if Edmonton were to be considered as a hub city, we independently came up with a list of protocols that we felt would adequately protect the public's health a few months ago, and we put that forward as our proposal of the conditions that we would need to have met in order to have Edmonton considered as a hub city. And the conditions, again, that we put forward were accepted, and I believe that with these bubble protocols, with the regular testing that's a part of the protocol that's, again, been accepted, and regular symptom checks, masking whenever people are not playing, if they are within 2 meters, those are the kinds of things that make me believe that it is possible to have Edmonton as an NHL hub city without risk to the public in Edmonton. With respect to the number of cases that we've had, again, I would say that we have seen cases in the last week to 2 weeks. Again, we've run sort of between 30 to 70 new cases a day over the last week. And what we know is that the majority of those have a known source. So we know where their exposure was, we're able to control further spread, and we aren't seeing the majority of those cases from an unknown community source at this time. I don't see, again, at the moment, if we have the current rate of cases continuing, that there would be a significant concern with having the NHL here as a hub city. And of course, we continue to monitor cases and would be very happy to work with the NHL if there should be questions about our cases. But at the moment, I believe that our measures are adequate and are sufficient to protect the public.